According to research, about 300,000 Ugandans are living with rheumatoid arthritis, which is one of the leading causes of disability that presents with fever, pain in the muscles and joints. This usually results in the disfiguring or skeletal deformities of the hands, namely the wrist. According to doctors, most of the people with this condition are unaware of the disease and most times end up getting the wrong medication.
Some will still hold beliefs that maybe they're being bewitched, which is quite wrong, or some will think that their disease is concerning particularly osteoarthritis, that maybe their disease is from a very unrelated kind of activity they might have engaged in. Okay, but predominantly you'll find that some delay to seek care because of this.
Noeline Ayomungu, a 19-year-old girl, is one of the patients who suffered with the condition for many years without clear diagnosis. Only at 4 years of age, Ayomungu was attacked by this strange disease that made her life miserable, and she had to spend most of her time in pain.
I was told that I used to cry every night, I'm heating up, but no one knows the issue. My mom generally didn't know. I was a child, all this pain started. Bones are paining, the joints are swollen, but it's the child is crying, you can't tell.
After many tests, Ayomungu was diagnosed with arthritis, but did not get clear medication for her condition.
I was 4 years, that's when they found out, but before that there was a series of different medications. Some people even tend to ask if I'm a sickler. Yes.
Like her, many other patients with this condition shared with us the challenges they face in trying to access medication.
The government hospitals, there are no medicines for arthritis, except in the private pharmacies. But the prices are so high, we can't afford.
According to Arthur Jungu, an arthritis patient, there is only one specialized doctor at Mulago Hospital who attends to over 60 patients in a week.
One comes from Tisoro, and to attend the clinic, it's very difficult to come from Tisoro that very day and you see the doctor. You find out that one comes the previous day, books maybe a lodge or a guest house where that person is going to reside for the night, then the following day he or she has to see a doctor.
This leaves most of the patients unattended too, and many completely failing to access him, especially those coming from far districts across the country.
Thursday is the arthritis clinic day at Mulago on 4th floor, but you can get a lot of patients missing the treatment due to what? Lack of medical personnel.
You reach there at 6 and at 9 you have not yet been worked on. It's just one doctor. The load is too much on him.
They are therefore demanding that government trains more specialists and distributes them to different health facilities across the country.
Because you can't just have, in Kampala, someone is traveling all the way, let me say from Soroti, to come just to Kampala to see a rheumatologist. And the issue is that you may come and then you bounce.
At least if we know that rheumatologist doctors are decentralized into every district, at least when we know that there is a rheumatologist on every health center, people will make an effort to reach.
The patients are also appealing to the government to include arthritis drugs on the list of essential drugs to be accessed by patients with this condition.
Medicines are expensive. You're going to find a painkiller that works for you, like each tablet is at 1,200, and you need for a month, you need for a week. If you multiply, that is a lot, and that is one, because at times they give you about 5 different drugs to work together.
Like malaria. We all know that there are drugs of malaria that the government procures. When we talk about AIDS or HIV, we all know that ARVs are available and they are given free of charge. But for arthritis, the medicines are not readily available. So we are requesting the arthritis drugs also to be included on the essential drug list that is procured by the government of Uganda.
A recent analysis of Global Burden of Disease (GBD) 2019 data showed that approximately 1.71 billion people globally live with musculoskeletal conditions. These include low back pain, neck pain, fractures, other injuries, osteoarthritis, amputation, and rheumatoid, among others.